Most of the time, what I have seen is, most of the hospitals I have seen, right from my MBBS days from 1983 onwards, professors, associate professor, anybody, they used to write cause of death. Immediate cause of death is cardiorespiratory failure or cardiorespiratory arrest or cardiac arrest or respiratory arrest or heart failure, like that. Same thing is seen by the student. Once student become consultants, they also started writing the same cause of death. But I want to clear the wrong concept in the minds of young doctors, maybe old doctors also. Okay. But now we say about cause of death, but strictly speaking, what do you call that? Form number 4 and form number 4A. The heading is medical certification of cause of death. Here, this is very important. Medical certification of cause of death is issued by doctor in two types of forms. It is known as form number 4 and form number 4A. What is the difference between 4 and 4A? The format of both form number 4 and form number 4A are same. Now, what is the difference? Difference is simple. Form number 4 you should fill when death takes place in an institution. Institution means maybe a medical college, maybe a hospital, maybe a nursing home, whatever you call. Whereas form number 4A is used in non-institutional deaths. So, for example, a patient comes to your clinic with the history of chest pain. You take ECG, then you see ST elevation, immediately collapses and dies. Already you diagnosed that the death is due to myocardial infarction, but he died in your clinic. Now you have to fill form number 4A. Whereas any other hospitals, you have to fill form number 4. Okay. Now, I can't show entire form in a single slide. All these things I don't want to talk on that because all of you know. Look here, the heading, medical certificate of cause of death. This is 4A. It is given clearly in the bracket for non-institutional deaths. Okay. I hereby certify that the deceased, Mr., Miss, or so and so, daughter of so and so, resident of so, under the treatment from to and died on date and time. Name of the deceased, you write the full name, sex, male or female, age at the time of death, as you know very well. If the age is less than 1 day, you write in hours, less than an hour, write in minutes. And if it is more than years, you can write in years. Okay. Now, coming to the cause of death. This is the most important aspect, cause of death. Cause of death, you see, it is given under two Roman number, Roman 1 and Roman 2. I explain in detail. Roman 1 is immediate cause. State the disease, injury, or complication which caused death, not the mode of dying, such as heart failure, asthenia, etc. And in front of 1, there is A. I'm going to explain again in detail. Under 1, number 1, immediate cause. Number 2, antecedent cause. Morbid conditions, if any, giving rise to the above cause, stating underlying condition last. Roman 2, other significant condition contributing the cause of death, but not related to the disease or conditions causing it. Then comes, if the disease was a female, whether the pregnancy, the death associated with, yes or no. If yes, was there any delivery, yes or no. Then you write the name of your medical officer, your name, signature. Then you put your signature also there. Okay. Now, most important topic. Now I ask you a question. Sorry. A patient of multi-drug resistant TB dies of respiratory failure due to lobar pneumonia. Which of the following options is the most appropriate for line 1A of death certificate? Now, please give me the answer. What is your answer? What is the immediate cause of death? What you are supposed to write in Roman 1a? Tell me. Please tell me. Anyone? Whether it is respiratory failure is the immediate cause of death, lobar pneumonia is the immediate cause of death, tuberculosis is the immediate cause of death, or multi-drug resistance is the immediate cause of death. Yes, tell me, please.
Sir, some people are telling respiratory failure and some people are telling lobar pneumonia, sir.
Okay. Whoever says lobar pneumonia, I agree. But whoever says respiratory failure, I don't agree. Now, I am here to explain. I explain in a beautiful manner so that lifelong you will never ever forget. If at all you forget, that means that you are suffering from dementia in future. Okay. Now, I already told you cause of that. One immediate cause, antecedent cause, other significant causes. Okay. Now, 1A. 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 State the disease or the injury or the complication which caused the death. That means 1A should be a proper diagnosis of a disease or condition. It is not something vague like cause of death. He died of diarrhea. He died of rhinitis. He died of sweating. He died of loose motion. Or he died of weakness. Died of asthenia. Died of heart failure. Died of respiratory failure. Died of cardiorespiratory failure. Died of cardiac arrest. Died of respiratory arrest. Died of cardiorespiratory arrest. No, no, no. Don't write all such vague symptoms under 1A. Not the mode of dying, such as heart failure, asthenia, etc. So, Kishan, all the students who told you that respiratory failure, they are wrong. Because ultimately, whatever the cause of death, ultimately, person dies of cardiorespiratory failure, stab injury to the abdomen, stab injury to the chest, stab injury to the brain, myocardial infarction, anything. Ultimately, everybody's heart also stops, lungs also stops. Definitely, cardiorespiratory failure will be there in each and every case. And if all of you write that cause of death is cardiorespiratory failure, then there will be only one cause of death in India or world. That is only one, cardiorespiratory failure. Should not write. Okay. Antecedent cause. Antecedent cause in the form A, 4A or 4, they may mention only 1B or 1C. But remember, antecedent cause may be only 1, or it may be 2, or it may be 3, or it may be 4, or maybe more. A to Z. A to Z. Of course, so many conditions will not be there. I'm just telling. Okay. Now, what is 1B? What condition has given rise to 1A? You should write under 1B. Morbid conditions, if any, giving rise to the above cause. What has given rise to 1A? You should write under 1B. What has given rise to 1B? You should write under 1C. That is the condition given rise to immediate cause. State the underlying conditions last. In other words, what comes first to the patient as a symptom or diagnosis should be the last. What comes last in a person, what exactly he dies, should be the first. First means 1A. Okay, I give you example, then you'll understand properly. Roman 2, other significant conditions not at all related to the cause of death. Not at all related to the cause of death, but may be contributing to the death. Not at all related to the cause of death. But there may be some sort of contribution to the death or may not be contribution. That you should write under Roman 2. In a very, very simpler way, I tell you, look here. There are 4 generation females. 4 generation females. Now, for example, if I ask you, you are due to what? You are due to whom? Let me talk about only the mother. You are due to your mother. Your mother is due to whom? Your mother is due to your grandmother. Your grandmother is due to whom? Your grandmother is due to your great-grandmother. Okay. So likewise, here, immediate cause, antecedent cause, it goes in the same way. Now, this small baby, if it is 1A, 1A is due to what? Because of her mother, that is 1B. 1B is due to what? Because of her grandmother, 1C. 1C is due to what? Because of her great-grandmother, that is 1D. Okay. I hope at least 50% you understood properly. Now I give you one simple example, then you become perfect. A person died of septicemia due to peritonitis as a result of perforation of chronic duodenal ulcer. So at last he died. I told you clearly, what comes first should be the last. What comes last should be the first. Now, tell me. Now I see, okay, Kishan, tell me, I am not seeing the messages here in YouTube. You tell me, my simple question, what a student supposed to write or what a doctor supposed to write under 1A? Tell me, Kishan, what answer you got? Under 1A, what is the answer?
Septicemia, sir.
Almost everybody wrote septicemia.
Septic shock.
No, everybody wrote the same answer.
They're writing duodenal ulcer perforation. Some people in Zoom they're writing, and in YouTube, 1 second. So in YouTube they're writing perforation of duodenal ulcer. Most of them writing duodenal perforation and septicemia. Some people writing. Most of them are in favor of duodenal ulcer perforation, sir.
Why they're writing like that? I just don't understand. If it is my live class, I would have beaten up them. I told clearly, no, Kishan.
Yes, sir.
What comes first should be the last.
Okay.
He suffered from what originally? Duodenal ulcer.
Yes, sir.
Duodenal ulcer has become chronic duodenal ulcer. Chronic duodenal ulcer got perforated. Perforation given rise to peritonitis. Peritonitis given rise to septicemia. And he died due to septicemia. So what came last is septicemia. That should be first, means 1A. So the answer is septicemia. Hey, Kishan, you are an expert man. I don't ask you question.
No,
Okay.
I am answering on their behalf, sir.
Okay. Oh, so, immediately they answered. Now they understood. You ask them, hey, my dear students, did you understand now? Or no? Tell me.
Understanding, sir. Understanding, but
They are writing understanding or understood?
this one 1A understood, sir. No.
Now understood, not understanding. Okay. Anybody is having any doubts or questions? Okay, now second question. Students, start typing immediately. What is 1B? Septicemia due to what? Due to what? What they wrote, Kishan?
No, they just writing, they understood. Now they're writing peritonitis.
Okay, perfect. 1B, peritonitis.
Yes.
Now, what you're supposed to fill under 1C?
They write perforation.
Perforation of chronic duodenal ulcer. Perforation can be anything. You should be specific. Say, for example, if you take a balloon and make a hole, that is perforation. Perforation of balloon. So it should be exactly, always you should be specific, you know. Especially forensic medicine, always I'd say, be specific. If you go to the hospital, if a professor asks, where are you going? Don't ever say that I'm going to see the case. What do you mean by case? Is it suitcase? Is it briefcase? Is it cigarette case? Sometimes they say, hey, he's a gone case, man. He's an ultra gone case. So case, different. Don't use the word case. You have to give respect to the patient. Don't call your patient as case. That is wrong, actually. Okay. Tomorrow a person going, where are you going? I'm going to court. Which court? Kabaddi court, badminton court. Court of law is specific term. Likewise, here also it should be very, very specific that it should be perforation of chronic duodenal ulcer. Okay, finally, what is 1D? What is 1D? 1D. Okay, tell me, Kishan, what exactly they wrote?
Writing alcohol, sir.
Huh?
In alcohol, NSAIDs, they're writing.
Alcohol. Why alcohol comes in between?
They thinking that is caused the duodenal ulcer and its perforation.
Oh.
And Dr. Sunita Roy is telling that it is acute peritonitis is the 1D.
No, man. No, not you. I'm telling. I'm sorry. Why perforation of chronic duodenal ulcer took place? Because of chronic duodenal ulcer.
Yes, sir.
First, chronic duodenal ulcer, then perforation, then peritonitis, then septicemia. Finished. Very simple. Okay. Now, same patient, imagine, was suffering from diabetes mellitus. Now we can write it under Roman 2, other significant conditions. Not related to the condition, but maybe contributing. Or if the person is having, say, malignancy of pancreas, carcinoma pancreas, that also you can write. Or any other condition he is suffering other than this, he can write under Roman 2. I hope all of you understood. Now I give you another simple question. A child died due to lobar pneumonia as a result of measles. What is 1A? In other words, child due to what? Answer?
Hypoxia.
Oh, I really don't understand. I have given only 2 conditions, lobar pneumonia and measles. Why they think of hypoxia? I don't understand.
Pneumonia, sir. Some telling pneumonia, some telling, most of them telling lobar pneumonia is the answer.
That is true.
Maria
Right,
is
due
really
to
well,
lobar
right.
pneumonia, it is a proper diagnosis. Why hypoxia? If you talk about hypoxia or anoxia, almost same. Hypoxia reduced, anoxia total loss. According to Gordon, he says each and every death is due to anoxia. What are the 4 types of anoxia? Number 1, anoxia. No oxygen at all. You go to Mount Everest. Do we get oxygen? No, he died of anoxia. I take a rope, tie around your neck. No oxygen entering into lungs. Anoxia. I push into water. Water enters into alveoli. No oxygen. Anoxia. An elephant comes and sits on your chest. Chest is totally compressed. Oxygen cannot go. Anoxia. At the same time, anemic anoxia. Severe hemorrhage or severe anemia. Oxygen is available, but blood cannot carry oxygen. Anemic anoxia. Stagnant anoxia, congestive cardiac failure, shock. Oxygen is there, blood is there, hemoglobin is there, but carrying capacity is not there. Blood is supposed to flow like a common crate, but here blood is going like a python. Stagnant anoxia. Number 4. Histotoxic anoxia or molecular anoxia or cellular anoxia. What is that? Cyanide poisoning, for example, which inhibits cytochrome C oxidase. Oxygen goes till the cells, but cell cannot uptake the oxygen. So don't use the word hypoxia, anoxia. That is modes of death, what it is, not the cause of death. Now here it is, medical certification of the cause of death. Okay, 1A, lobar pneumonia due to what? What is 1B? What is 1B?
They're telling measles, sir.
Finished. If you go through your community medicine book, PARC, E PARC and P PARC, it is mentioned, essence of death certificate is 1C. With the due apology, I don't agree. What do you mean by essence of death certificate? First of all, person is dead. What is the essence in death certificate? For example, in this case, 1C is not at all there. Only 1A, 1B. Then can you throw the death certificate? There is no essence in this certificate. That is wrong. Okay. So what exactly is there in the baby? You have to write. Then again, people may say lobar pneumonia due to measles. Measles due to what? Measles due to mother delivered. Mother delivered why? Because mother got married. So mother delivered is 1C. Mother married 1D. Why mother married? Her parents forced her. That is 1E. Don't go on thinking too much. Just think as a doctor using your medical knowledge. Okay. Now, I don't think anybody will do mistake as of now. A person died of myocardial infarction as a result of coronary occlusion as a consequence of atherosclerosis. Okay. What is the immediate cause of death? Kishan, why you disappeared?
MI, sir, MI. No, I'm there, sir.
No, I can't see your...
All are answering correctly, sir. As MI.
MI. Okay, 1A, MI. 1B.
1B, we are typing still. Coronary occlusion, they are telling, sir.
Wow. 1C.
1C. Mr. Pukar is answering really well. He's telling atherosclerosis.
Yaba. See, now 90% people answered properly, I think. Correct, no?
No, all are answering correctly, sir.
100%.
100%.
Okay. Congratulations. Now, bit too complicated than before. A person died of uremia due to chronic bilateral renal failure as a result of hypertension as a consequence of polycystic kidney disease. Now I want 1A. 1A.
Uremia.
Uremia. 1B.
1B, still they're typing. So don't tell answer. Let them. They're telling chronic renal failure.
1C.
1C is some telling hypertension, and they're all in hypertension. They're telling, sir.
Hypertension. Automatically, 1D should be polycystic kidney disease. Originally he suffered from polycystic kidney disease, which has given rise to hypertension. Hypertension has given rise to chronic bilateral renal failure. That has given rise to uremia. Okay. Now, a patient died from bronchopneumonia following intracerebral hemorrhage caused by cerebral metastasis from primary squamous cell carcinoma of left main bronchus. Which of the following options is the most appropriate for line 1A of death certificate? Okay, now let me know.
1A is no, they're telling bronchopneumonia, sir. Sorry.
Perfect. Okay. Now let them tell what is 1B. Bronchopneumonia due to what?
Due to D, they're telling some telling ICH and some telling SCC of left main bronchus.
Sorry. See, I tell you, dear students, person suffered from squamous cell carcinoma of lung. Okay. That has given rise to cerebral metastasis. Cerebral metastasis has given rise to a complication in the form of intracerebral hemorrhage. Whenever a person suffers from intracerebral hemorrhage, usually he becomes unconscious or comatose. That time, it gives rise to hypostatic pneumonia in the form of bronchopneumonia, and he died of bronchopneumonia. Your unconsciousness is not mentioned. So, bronchopneumonia is due to intracerebral hemorrhage. Intracerebral hemorrhage, maybe hypostatic pneumonia later, which has given rise to bronchopneumonia. So, 1A is bronchopneumonia, 1B is intracerebral hemorrhage, 1C is cerebral metastasis, 1D is small squamous cell carcinoma of left main bronchus. Okay. This is, I already asked you. Now I don't think anybody will do mistake. What is the answer here? Kishan? Kishan?
They're telling again answer is B, sir.
Anybody?
Lobar pneumonia.
Anybody has written respiratory failure?
No, majority are telling lobar pneumonia, sir.
Majority means some people have written something else. Yeah.
No, all in favor of lobar pneumonia.
Yeah, correct. Never ever write respiratory failure. Now, I think here people will do mistake. Again, I'm telling you, don't ask me so many questions because I'm not a cardiologist. Cardiologist has to help here. As a forensic expert, I just ask you only one question. What is 1A? That's all. I'm interested in only 1A. If you want in detail, please ask a cardiologist.
They're all telling left ventricular failure, sir, unanimously.
Perfect.
They understood.
Because you're not supposed to write heart failure, but LVF is a diagnosis. LVF is a diagnosis. Okay. That is regarding, I think now everybody got an idea. Anybody who is having any doubts, let them speak.
One in YouTube is asking, sir.
Yeah.
Can we write sudden cardiac arrest as a cause of death? Sir, sudden cardiac arrest can be written in 1A is asking.
No, I said cardiac arrest itself is not supposed to be written. Then there is nothing like sudden cardiac arrest, insidious cardiac arrest, gradual cardiac arrest, slow, cardiac arrest. No cardiac arrest, that's all. But people write cardiac arrest because most of the time in newspaper they say somebody, some VIP, died of cardiac arrest. I don't know. There should be some reason for the cardiac arrest, no? Without reason, the heart will not stop of its own. There should be some reason. Okay. Anything else, Kishan?
They're just commenting, sir. Your method of teaching or sequence is great. They are telling this stuff.
Okay. Now let me speak about specific requirement about the certification of death. Remember, there are some ethics behind issuing death certificate. Number one, to safeguard yourself, if the doctor in attendance is convinced that death is due to any natural cause, he must issue death certificate. He cannot deny issuing death certificate. If he is a treating doctor, if he knows that his patient died of natural diseases, his duty is to issue death certificate. Okay. Number two, he should not charge any fees for issuing death certificate. No fees, no fees, no fees. Okay. Number three, he cannot delay even if his own professional charges are not paid. Many times, I know hospital authorities, unless you clear the bill, we are not going to give the dead body. That is wrong. It is inhuman. You have to hand over the dead body. At the same time, you can sue the nearest kith and kin in a civil court for the payment of your fees. But you cannot withhold the dead body with you. So, for example, imagine tomorrow, hypothetically, my father died in the hospital. Pending bill is 2 lakhs. I don't have money. I ask for the dead body. They say we don't give unless you issue, unless you pay the money. I am 100% atheist. What I say is, when the person is dead, it is just like the table, chair, immaterialistic thing. I say, okay, and I go. What they do with my father's dead body? Tell me. If there is cold chamber, okay, they can keep in the cold chamber. If there is no cold chamber, how long they can keep? I don't come one day, putrefaction starts. Then they have to bring some ice cubes, keep all such things. I come after 10 days, body totally petrified. Then I can go and lodge a police complaint that indignity to human corpse. They did not give me the dead body. Because of the hospital, my father's body petrified. It is indignity to human corpse, and I can sue them. And police can file a case on 297 of IPC, indignity to human corpse. So don't delay. Number 4, the certificate must state the exact cause of death, like what I explained. Don't write heart failure. Heart failure. Okay. That regarding specific requirements about certification of death. That regarding death certificate. Anything else you want, you ask me. Or any other questions are there, Kishan? Any other questions are there in the YouTube or Zoom? Yes or no?
They're asking if this applicable to private hospitals also. Same thing.
Any hospital for that matter. Any hospital. What? Private means what? They have come from heaven. No? No. Indian law. Nobody can withhold the dead body. I told you clearly. They have to sue the party in the court of law for the recovery of the fees. That's all. That is illegal. Private, government, semi-private, semi-government, whatever it is. Okay. Anything else?
Dear members, now this, I hope this topic is clear now. Sir has made it so effective to learn. Okay, so I think this topic is very much clear now. Regarding any other topics, when we read, if you had any doubts, you can ask him directly regarding any topics.
Hey, any other topic in forensic medicine? Not about American
Today,
politics.
so many students, sir, call him directly or message him regarding so many problems, even for career oriented or for guidance or forensic. Yes, definitely. I still stand by my words. He's the authority, means as a teacher, he's the best teacher. That's me, authority. I didn't mean that he's the lawmaker or anything. Okay, still he's the authority only.
Yeah, in that case, okay, yeah, here one more thing. Kishan, 1 minute, 1 minute. I already told you have to issue death certificate only when you are convinced it is natural cause of death. If at all you suspect about the cause of death, and if you feel it is unnatural death, and if you are not sure about the diagnosis, then you should not issue the death certificate. You have to inform the police. You have to inform the police so that they will arrange for postmortem examination. At the same time, one more thing. Unless you are 100% sure about the cause of death, a person, many times a person comes, doctor, my father expired. Give me death certificate. Don't give. Unless he dies in the hospital or unless he dies right in front of your eyes, where before his death you diagnosed about the disease, then only you issue death certificate. Okay.
Some students are confused about what about the broad dead cases, sir? What to do with the broad dead cases?
Broad dead. Don't issue death certificate. Immediately have to inform the police. Don't issue death certificate. Not only broad dead, there is a condition called dead on arrival. There is a difference between broad dead and dead on arrival. Broad dead means, say, for example, I tell you, this is the casualty door. Okay. Patient comes here, open the casualty door, enter inside. As soon as you examine, there is no signs of life. That is broad dead. Dead on arrival means while entering inside the casualty door, person was still alive. Then you shift him on the bed. After 2, 3, 4, 5 minutes, he dies. That is dead on arrival. Not only that, even if the person is admitted for 2 days, even in 2 days, you are not in a position to diagnose the death, cause of death. Again, you have to inform the police. You are not supposed to issue the death certificate. Unless you are confirmed with the death, cause of death, you should not issue the death certificate. That is very, very clear.
Sir,
yeah.
Some hospitals issue death certificates to their, even though if it's broad dead, for the regular patients, if they knew earlier the patients, but so now suddenly broad dead. Can we give like that? If I knew the patients earlier?
No. There is one problem. There is one provision that if a doctor has been treated the patient within the last 14 days, and if he has been convinced that it is due to natural, he can issue a certificate, but it is very, very risky. I tell you exactly, one Mangalore doctor who is settled in Mumbai. Okay. I don't want to mention the doctor's name. He is almost of my age as of now. He had one couple, old couple, very well taken care by housemaid, known cardiac patient. One day, then my wife died, only father was there, the old man was there. One day that housemaid was very, very nice. She was taking very good care of the old man. She came and told us, sir, this one owner died. Can you issue death certificate? And without seeing the dead body, he issued death certificate. Okay. Afterwards, his son in America lodged a complaint. I don't think, because just 2 hours before so-called death, I have spoken to him perfectly all right. Then investigation took place. Then they realized, after investigation, even though the maid was very, very nice, out of her niceness, this old man has written one flat in Mumbai in her name, which is costing about 1.5 crores. And her housemaid had a love affair. She wanted to marry him, but she did not have money. Then she thought, if he dies, I become the owner of the property. Then we can sell it, we can marry, and we can settle. You may not believe that female got life imprisonment. Meantime, this doctor was in the jail in Mumbai for 2 years. The risk will be there. If you are ready to take risk, then it is up to you. Otherwise, no. As a legal medicine expert, I just want to say, don't issue death certificate in broad dead cases or unknown causes.
Sir, can we go to their residence and declare death and issue a
No,
death certificate?
that's what I'm telling. You can go to the residence, but once you go to residence, if the person is already dead, you cannot issue death certificate. After death, you'll not come to know, no, how he died. That is the problem.
If you know, we can issue, no, sir. If like last moment we went there, we treated everything.
No. That time, many doctors, what they do, no, they simply write that on arrival, patient is gasping, severe chest pain, complaint chest pain, sweating, MI. Like that they give. They can't say that when I went already found dead, they never write.
And we can never use this word cardiac arrest anywhere.
Cardiac arrest?
Wrong terminology, sir.
Yeah.
I'm asking.
No, cardiac arrest can't write. You can't write cardiac arrest.
So, sir, I'm in a remote place, PHC maybe.
Yeah.
Some patient brought dead. I'm trying to contact police, and police are not available.
Yeah.
And patient want to take the body home or child home, whatever. So, what can be done in such situation? Is it my responsibility to?
No. All these are the problems what you doctors suffer.
Yes,
because
sir,
whenever a patient party comes, no, they'll be against postmortem. They say no.
Yes, sir.
Give us the body back. Even if they give the body back, forcibly if they take, you cannot prevent them. Correct? No. Patient party brought a patient in the casualty. Then you say no, keep the body. They say no. Some 10 people together, they take back into the ambulance.
Yes, sir.
In such cases, you have to note down the ambulance or vehicle number and you have to inform the police immediately over telephone. You have to inform to safeguard our interest. Okay.
So then brought dead patient, where they get the death certificate finally?
No, it has to go for postmortem examination.
Okay.
That's all. At the same time, if at all you are especially NEET PG exam going students or FMB exam going students, I have uploaded about 55 files of extra edge topics as well as previous year questions in forensic medicine, which if you open the files, you can see that. You can just type @forensic JP, then you can go through. Not only that, I have given my personal number also. Anytime you are stressed in life, or you're confused, or you're depressed, you're stressed, you can contact me at any time.